Thoracic surgery is a specialty that involves the surgical treatment of diseases of the chest being the part of the body called the thorax. It goes from the base of the neck to the diaphragm, down above the abdomen. Typically, thoracic surgeons are consulted by other physicians that, for one reason or another, in a common situation for us, have discovered a spot on the lung. And a spot on the lung, which you'll see on a chest x-ray, will typically be referred to as a tumor. Now, the question is whether or not this tumor is a benign process, meaning that it's of no real consequence to the patient, or it's a malignant or a cancerous process. The surgeons are called in when it's necessary to either biopsy the mass or even remove a portion of the lung. This patient was found to have a spot on the right upper lobe, which is a right lung, and subsequently they were referred for a CT scan. Now, when they go get the CT scan in the radiology department, what they found was a nodule in the right upper lobe, as we confirmed. Again, on the CT scan cut in a different configuration, we can see the spot in the right lung. And there's no evidence on the CT scan that there's been any spread to the lymph nodes. So in this patient, they would be referred to a thoracic surgeon who would perform the operation, and in doing so remove that portion of the lung. It's considered a major operation. It's done under anesthesia. There has to be an incision in the chest that goes between the ribs, and then the tumor is initially removed. If we don't know what it is exactly, it would be removed and sent to the pathologist immediately, where they would perform what's called a frozen section. Based on what they would find immediately, if it's benign, we're done. We close the patient, and that's the end of the operation. But if it proves to be malignant or cancer, then we proceed with removing that part of the lung. The follow-up depends on what we find at the time of surgery. At the time we remove the nodule, if it's been proven to be cancer, we will proceed with removing a large number or many lymph nodes inside the chest in what we call the mediastinum, which is the central part of the chest. If those lymph nodes prove to be negative, that's generally all we do, though there are other type protocols. But if those lymph nodes prove to have cancer or be cancerous, then oftentimes the patient is referred for chemotherapy. Our follow-up primarily involved in just ensuring that the patient's incision heal and that their pain is controlled, and then the other doctors manage the remainder of that care in the metastatic case. Surgery and removal of a lung cancer is really the best and most effective treatment, but it's very important that it be found early.